Dr. Madhu Uddaraju will really counteract patient with 50 years old age with a clear lens. He doesn't want to touch the clear lens, rather he wants to put a presbyopic IPCLs.
I don't know what ma'am has against me, sir. She made me debate against Kashyap, sir, his daughter-in-law, and now the president of AOS. So, sir, I did not choose it, so don't. It was an option. Right. So, spectacle independence for a 50-year-old. So, 50-year is the key word here. And why presbyopic IPCL in these cases? No financial disclosures. So, my point is, when you are telling it's a clear lens, why do you want to touch it? And why don't you choose a procedure that is reversible, that has better predictability, that has better visual recovery and faster adaptation? And also, if the patient does not adapt, you are having an opportunity for a second chance you are giving here. Their chance is taken off. So clear lens, so these are a lot of articles like sir has quoted now I have some articles which tells that there is no point in touching a clear lens. 50 to 55 is a gray zone. Above 55, there is no argument, but 50 still has a very high risk of retinal detachments and also macular problems. And Douglas Koch, I think he is also in an opinion that it's better to delay clear lens exchange until 55 as the complications are more, and he is not still satisfied with the choice of multifocal IOLs or refractive IOLs we have in the market, because what we see 10 years before is not what we see today. So if you are giving this patient that additional 10 years, the technology may also advance. So reversible. So whenever the patient is unhappy in these situations, it's very easy to explant an IPCL when compared to an IOL that is in the bag. And you still have a reserve procedure in these cases if the patient is not satisfied. And this experience can help you choose a better IOL in the future. Suppose the patient is not happy with a particular diffractive IPCL or a need-off IPCL, then you choose the other technology for an IOL. So that is how it is useful. And predictability and visual outcomes also. When you see, though both RLE and phakic IOLs have very good outcomes, visual outcomes when compared to RLE have better in cases of phakic IOLs. These are all the references that tell that the visual outcomes are better, because here you are not touching the natural optical system. You are just adding a lens before it, and there is no adaptation time for this new optical system. And almost immediately post-op, the patient can read. You can see the wow factor. There is no neural adaptation time, as it's an adjuvant to the natural lens that is there in the eye. So, and also, as I've told you, the last point is opportunity for better technology. There is a decade of opportunity that you are giving to the patient. Now, no longer we are using restore. Probably 10 years down the line, you are not going to use your PanOptics or Vivity. So, multifocal IOLs, even today, are still evolving, yet to get a perfect design. So, I would prefer a irreversible and less invasive technique of phakic IOLs in these cases. Thank you for your time.
Oh, really? The expert panel is Dr. Kudlu.
So may I comment one?
Yeah.
So I think Madhu is richer than me because he's looking for a versatile technology so that he can operate patients many times. I think you should also look for the ICL, IPCL or the IOL which actually degrade in 5 years' time so that we can keep on operating same patients every 5 years. So that will make us much more richer. So the basic that you are looking for reversible technology, that means do not trust the technology.
Yeah, as a panel, I got a different view. 50 years old patient, no cataract. If the DLI shows that more around 10, my option is going to be Presbyopic. If the corneal refractive surgery, if I can do, Presbyopic is my best option. Patient do really well. But here the debate is between the clear lens versus the IPCL. Of course, I have to stay in general council. I have to stay with my president. He is the most important person for me. Okay, so, but apart from that, in fact, you are right that we are not touching the clear lens, so chances of retinal detachment will be definitely much lesser in IPCL. But there are patients with presbyopic IPCL also developed retinal detachment. Also, patient complaining of something, a black round object in front of eye, and also they got a glare and halos. But in comparison to these lenses, the complications of presbyopic IPCLs with the clear lens extractions are almost glare and halos are almost the same. Comparable. So in such cases, I think what sir says that I think
also
once
agree.
for all the surgery.
I
Give him
also
the
agree.
best. I think my hat is towards the clear lens extraction lenses, Madhu.
You, Dr. Cap?
प्लीज वेट जब बैठ जाइए
Please sit. We'll give the mic. Please give him the mic. Who is he? God. क्या हो रहा है?
कैसे he has come? अभी आ गया. He's asking question.
Why the doctors are very strict?
वेरी गुड क्वेश्चन सर He's asking why the doctors are wearing specs while they are performing surgery on others.
Yeah.
Hello.
That's
So I think the
Why the all doctors are wearing specs? You are advising oils to the cost of a patient.
no. So so far as if you see many of my colleagues who have been emetropic, I'm giving you the answer. Just please wait. Many of my colleagues who have been emetropic since childhood, once they become presbyopic, I had a Dr. Anita Sethi, now Tinku Bali, and there are so many others. Once they become presbyopic, they find it very, very difficult to use the glasses because they never had habit of using glasses. So every time they keep on searching in the bag whenever they need to read, they keep on searching in the bag where the glasses are. So how you want to feel and just feel and look like is entirely your personal prerogative. So some of the patients do feel that they don't want to use the glasses. They are more than happy to go for it. But these surgeries are not forced surgeries. We do not force the patient to.
उनका क्वेश्चन सुन लो he is very restless.
Prashant,
क्वेश्चन तो यही है ना कि क्यों
Mic
doctors
ले
ने
लो
क्या
इसका.
He says something else.
One question from if you are born to be what the choice of you? Uh, 20 years old boy having specs. Why he go for
बंद हुआ सेशन में टाइम खत्म हो गया.
अभी time is over.
नहीं सर क्वेश्चन ये है नहीं मैडम एक मिनट देखो सर सर्जरी ज़बरदस्ती नहीं करते हैं जो पेशेंट आता है जो चाहता है उसके लिए करते हैं नॉट इट्स रिकमेंडेड
We don't recommend. Actually, some of our friends, ophthalmologists, also underwent Presbyon.
Yeah,
Sri
yeah.
Ganesh is the best example
they
for
also
that.
underwent LASIK
I only moderated his surgery. He has done Presbyon almost 10 years. He's got 6 and 5.
so these
So
surgeries are
already we are given the conclusion. The best in this debate, I think Dr. Harbanslal has got a upper hand, that clear lens extraction.